Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So are you ready to know what is today's topic is? Yes, by the thumbnail itself you have identified. So today's topic is caution, that is warning signs of cancer. So without wasting much time, let's get started into the video. So before going into the video, kindly like it, share it and subscribe it, and kindly drop down in the comment box if you find this video to be useful. So before going into the warning signs of cancer, we have a mnemonic, that is caution, up. So before and all we know only up to caution, but now recently UP, that is up, has been added to this mnemonic. So before proceeding to the topic, we will see what is cancer is. A cancer is a disease in which abnormal cells divide uncontrollably and destroy the body tissue. So here what happens, the cancer cells will multiply or proliferate without any control, and they will go and engulf the normal cells. They will not allow the normal cells to grow. Instead, the abnormal cancer cells will go and occupy the normal cells, and they start proliferating or multiplying themselves. So now we will see what are the warning cancer. The mnemonic is caution up. C for change in bowel and bladder. A for a sore that does not heal. U, unusual bleeding or discharge. T, thickening of tumor. I, indigestion. O, obvious change in what. N, nagging cough. U, unexplained weight loss. And P, pernicious anemia. So we have seen a mnemonic, caution up. So these all are the warning signs of cancer. If you see this warning signs in your body, or if anyone is telling you, as a student nurses or as nurses, we have to assist them and immediately ask them to seek the medical intervention to have a early diagnosis and treatment. So we'll see one by one in detail. So in warning signs, the caution up, the first letter is C. So C is change in bowel or bladder. So we can see a noticeable changes in stool or urine, and there will also be a change in the bowel frequency. So suddenly their bowel frequency will be changed, like how to say, it will be either diarrhea or constipation, or sometimes they may even have blood in the stool, that is known as melena. Next warning signs, a sore that does not heal. So in an individual, if there is any wound, it has to be healed within a few weeks. So that is a normal process. So here what happens, the sore that will not heal even after many weeks. Next is U, that is unusual bleeding or discharge. So especially we can see those discharges from rectum, vagina, mouth, or even unusual discharge from any orifice. Next T. T is thickening of tumor. So especially where you can see is we say no, like you have to do the breast self examination and all. At that time they will say like I have very thickening of tumor, so or any other part of the body. I is for indigestion. Suddenly they have a difficulty in swallowing, or sometimes what happens, they feel like fullness even after eating a small meals. O is for obvious change in what. If any person is having what happens, suddenly there will be change in the size or color, or suddenly what happens, there we can notify there is any change in the size and shape of the moles or the warts. Next is N, that is nagging cough. They will have a persistent hoarseness of voice. So they will be clearing their voice, no, like like that. They will have some hoarseness of voice that is persistently. U for unexplained weight loss and without trying to lose weight. So that persons will not be making any necessary effort to lose weight, automatically they will lose their weight. P is for pernicious anemia. So pernicious anemia is caused due to the vitamin deficiency, that is vitamin B12, cyanocobalamin deficiency. So here the pernicious anemia plays a major role in various cancer causing diseases. So this is also one of the symptoms of acquiring any GI or any kind of cancer is. So that's all about the warning signs of cancer. So in many competitive examinations we are seeing that they will ask like in caution, what is mean by U, what is mean by N, like that. So as a nurses, we must be very updated to know and learn each and every day to become a professional and competitive nurse. So if you find this video to be useful, kindly like it, share it and subscribe it, and thank you for watching.